more minute. Yeah, it's probably like a few seconds. Boom. 8 o'clock on the dot. Welcome to Common Mansplaining, everybody. Welcome back to the show. I hope this is working. If not, I'm going to be in trouble. We'll see. Christian should be joining us any moment. All right. Let's see if it's on. Welcome to Common Mansplaining. Let's see if that worked. I think we're good to go. We're finally up and running. Ladies and gentlemen, welcome back to the show. Christian should be here any minute. I'm not sure exactly how long it's going to be. He said he made it home. He's just probably getting ready to sign in. But in any case, welcome back. Oh, here he is. Look at this. I think I got him. Woo! We got him. Right on time. Look at that.
Yeah.
Oh, my gosh. All right. I got a quick disclaimer before we get started. I'm having one of those crazy nights, so you might see me shuffle around in my seat a lot, but I'll be all right. Speaking of health problems, we're going to talk about healthcare tonight. The Frankensteinian monster that has taken over the universe. I tell you what, America has. I've looked at like maybe 20 different health systems today as part of like my research, of course, as I always do, and America's is by far the weirdest. Like, it's weird. Like, I sometimes that's a good thing, right? Like, one of the things that people forget about, because one of the first things that people say when it comes to healthcare is like, we're the only country that doesn't blah, 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 blah. And I'm like, well, we're the only country that does a lot of things, right? Like, so that's not necessarily a bad thing in and of itself. Right. But of course, it's usually used in a negative context. It's usually like, we're the only country that doesn't have universal health care, or we're the only country that doesn't do this, or we're the only, and it's like, we're also the only country that preserves our freedoms. We're the only country that does a lot of, we're the only country that has the military might to defend ourselves, really. We're the only country that does a lot of things. But so it's weird. It's weird. And just before we get started, I just want to describe the stakes here of the healthcare system, right? So what people talk about when they're talking about the healthcare system is usually not actually healthcare, right? Usually what they say and what they mean is health insurance, right? Or like the ability to cover healthcare, the way to pay for it, right? Because the care itself is accessible to everybody on earth, right? Anybody can go to a doctor. The question is, how do you go? Is it covered? Does it get paid for? How much of it gets paid for? Who's doing it and why? And, and what are the doctor's costs on the back end, which a lot of countries don't even see. But so that's what we're describing. It's not like we're describing, do we allow doctors in the nation or not? It's not like we're describing, is there healthcare? Is there not healthcare? There's healthcare everywhere. It's just, what about?
It's also, we discussed the healthcare industrial complex.
Yes.
Right. What it is involved in, and its bureaucracies, its eccentricities, its gatekeepers.
Yes.
And its oligarchs.
Yes.
Frankly. So.
Yeah. Yes, definitely. Yeah. And that's actually going to come up. That's going to be a recurring theme tonight. The Big Pharma, basically, and a couple of other giants are basically what control interests in America. Now, so one thing to talk about before we get started is there's a couple of different types of broad structures of healthcare. One of them, of course, is private healthcare, which many of us are familiar with in the United States, which is like you go to an insurance company if you want, or you don't have to. You can always just pay the doctor directly, right? That's private healthcare. That's basically you are paying for a service, you receive that service, and then you exchange funds or something, right? One of them is public healthcare, which is usually something along the lines of you pay taxes and then the government does that for you, right? So they pay whatever doctors or whatever subsidizing co-fees or whatever is involved. And they cover your, some of your prescription drug costs and stuff. Never all of it, which I've always thought is kind of weird, right? Like, it doesn't seem like anybody's willing to just bite the whole bullet and so, but
it's like deductibles insurance. They want you to have some skin in the game for some reason, so that it's not frivolous, or else you might just get pills and just throw them in the garbage or something. Like if you have at least some skin in the game, that thought that you'll actually take the medicine and take it a little more seriously because you've invested it. So
That's fair. That's fair.
Yeah.
And then the third one is basically charity or voluntary healthcare, which does happen rarely, not so often as you might think, but there are some, like March of Dimes and American Cancer Association and stuff like that. There's definitely places out there that do churches, local communities do stuff like that. So those are the three broad structures. Then there are also what I refer to as three pillars of healthcare, which are basically the three effective things that you would look for in a healthcare system, things you'd want to acquire in a healthcare system, right? One of them is cost. That's the big one that we all whine about.
Be low cost, affordable.
Yes, you'd like it to be as little as possible, right? One of them is, accessibility or like availability of care, right? Like how long
widely available.
Yes, how long the wait times are, or whether or not the doctor that specializes in your particular thing is present, that kind of thing. And then the last one is quality, right? Like their level of expertise, their knowledge, the technology available, and stuff like that, right? And sometimes, to a lesser extent, like the amenities, how good the food is in the hospital, whether or not you get your own room, air conditioning.
Yeah. I mean, it's that classic thing of American doctors sometimes would go to South America and be like, I know how to cure or this thing, but I don't have the tools. I don't have anything available. Right? I have this disinfectant or sort of topical antibody, and then you treat the symptoms, kind of thing. Like anyway, right? So you can have knowledge, right? Yeah, but then lack the tools for healing.
Very true. Yeah, it's like when I was growing up, it's like just put Robitussin on it; it'll fix anything. Just like put that tussin on it. Get to the bone. All right. So, largely speaking, you will almost never find more than two of these three pillars in any healthcare system. Right? You'll find a healthcare system, for example, that's got great availability and great quality, but it's expensive. That's us. Right. You'll find a healthcare system that's got decent availability and great cost, but the quality isn't all there. That would be probably something like the UK would be a good example of that, or Canada maybe. Or you could find a place that's got good quality and good cost, but the availability is lousy. Right. And it's not, that's a good case scenario if you get two of the three. A lot of times you'll see systems that get one of the three or like one and a half of the three. But your goal, of course, is to get all three, but that's just, that's like a unicorn. You're just
yeah. So when it comes down to public policy or as far as government, it's which one of these three are you going to emphasize right now at a time?
Right.
And so, right, when Obama 15 years ago came into office, his push was to push the availability.
Yes.
Right. So with the Affordable Care Act, the whole drive was to get people that weren't currently on insurance enrolled in some type of health insurance.
Yeah.
Right. And to increase the numbers of that. That was the goal. It was thought that hopefully down the line, enough people would choose when they went to buy their health insurance, would always choose the cheapest option, or enough would, that it would drive competition between companies to be that cheapest option.
Right.
And then they would put pressure on other medical things to be more affordable, and then that would help drive down costs. But that really wasn't a priority. The priority for all of Obama's time was really just to expand availability.
Right. And interestingly, it's like kind of like I described in the beginning. It's not like people didn't have access to it. They did. But one of the weird things about America is that we have this so there's a couple things going on. One of them is the Hippocratic Oath, right? Which doctors can't turn away basically a patient almost. They basically have to help. They can do no harm, and they basically must do as much as they can to help heal as they can, right? And you combine that with our emergency room process, which almost always allows for admittance before pay. And what happens is a lot of people will take advantage of that system, right? For example, like my ex-roommate would routinely go to the ER like anytime he had the flu, right? Like he would just go to the ER. That was the only thing he would go to, because he wouldn't go to like a doctor's office visit for a primary care physician, and he wouldn't go to urgent care because both of those would charge for money up front. And so he couldn't afford that. He would never pay. He would always go to sometimes he would even take an ambulance if he like wasn't feeling good enough, and like literally run up like a $6,000 medical bill, which wasn't even really $6,000, but we'll get into that later. But it'll say 6,000 on the bill, and then he goes in and he gets, antibiotics for a strep throat or something like that, something that he could probably beat on his own without going anywhere. And then he would come back, and meanwhile, everybody else that goes to the doctors anywhere basically bears the brunt of that cost, because they're charging us because they know they're not getting any money out of him, right? And so what Obama wanted to do in a perfect world, what everybody wants to do, right, is have everybody get healthcare at an affordable rate, right? And what happens now is that some get it at an affordable rate, some don't. And some get it, some get it cheap because they just don't pay anything. Hey, Ryan, how's it going? Welcome aboard. And some people have to pay a lot because they're having to pay for the people who are just, using the system, which
free riders. Yeah, free riders.
Right.
So it was Massachusetts that the first tried to eliminate free riders, because they had in their budget all this money that they had to pay, that they would pay to hospitals for those free riders, right? And so it was Mitt Romney who first said, well, what if we take this money that we're already budgeting to pay free riders and just use it to sign people up for insurance?
Right.
And I mean, it was an experiment, the type that you try on small populations, like a state. It's a place, something you do in the state, and and it was still very early, but the idea was so novel. And with Romney being a Republican, Democrats were worried that if it was really found to be really successful, that it would be attributed to Republicans. So they jumped on it, claimed it as their own before it could be fully tested out, and expanded it not to a state level, a small state at that. They went,
of course. Of course. And that's, leave it to Democrats to jump to the federal level first, where of course it's unconstitutional, but I've said that probably a million times. So that's all right. So let's talk about America's strengths and weaknesses, right? So as I mentioned before, out of the three pillars, between one is cost, one is availability, and one is quality, we have two of the three. We have availability and we have quality, right? There's basically no other place you want to be on Earth if you have a complicated problem, right? If you have like cancer or something really technically complex, anything that requires a lot of technology or a lot of expertise, there's really nowhere else you want to be. And people will come to America for that. Like even countries that have public health care, if they get something that's like serious or like they need like a triple bypass, something that's complicated, they'll go fly to Duke, to get whatever they need done, because that's the best way to take care of it. And so that's one of our biggest strengths, is that we're technologically advanced. We do all of the innovation here in-house, basically in America. No other nation is really doing the kind of like research and development for new drugs or, cutting edge biochemistry or like AI work where it interfaces with, or like Neuralink with Elon Musk. Like nobody else has that kind of stuff, right? It's really just America. And unfortunately, we pay for it, right? That's the downside. Now, we have other strengths, but you get the gist of that. Now, that's like all the other strengths are kind of like in that same echelon, right? They're all like high quality, very expert level doctors, like very capable surgeons. We have like research clinics like Johns Hopkins and the Mayo Clinic that are like just, out of this world good. But because of that, and one of the other problems is that like our pharmaceuticals, and I still haven't figured this out, even after all my research today, we seem to pay for like the world's pharmaceuticals. And I'm not sure why. And I'm not sure like whose plan that was, or it's so weird. But anyway, so I guess part of the problem, so these big companies, pharmaceutical companies, they have to do research and development to get new drugs, right? They have to pay for the person who first like cites the research, and then they pay to buy the research, and then they pay to develop it, and it costs a lot of money, and it's very, very risky. And so what happens is we end up paying for that in America, just like we end up shouldering the burden for a lot of things in America, just like we end up protecting everybody with our military in America, and we end up protecting everybody's shipping in America, and we end up doing for the world in the medical front, just like we end up doing for the world everywhere else. And unfortunately, you can see that like tack on to our price point, because America's like, I think if I got my research right, we're at least 30% higher than any other nation on earth as far as how much we spend on healthcare each year. Um, Part of that is our culture, right? And how unhealthy we are, right? So part of the cost is just the fact that we have like a lot of a lot of obesity. We don't eat right in America. We don't exercise. We don't take care of ourselves. A lot of it is like drugs, alcohol, smoking, weed, et cetera, et cetera, et cetera. A lot of that, contributes to the problems that we have in America. One of the interesting comparisons I've noticed is like, if you were one thing that people like to use to like try to track how good somebody's healthcare system is life expectancy, but it doesn't actually work that well as a metric, because what happens is like if you were to like match our life expectancy with somebody in Switzerland, for example, they have a higher life expectancy. But if you were to take a Swiss person and put them in America, they have a higher life expectancy in America as a Swiss person, right? Because it's their culture that makes them have the higher life expectancy. And if you combine their culture with America's like technological advantages and expertise and quality of care, you actually produce the best product. The problem that we have in America is very, very cultural, right? It's like, yeah, Jamie says our food is filled with salt and vinegar, yeah, and processed nonsense, and like high fructose corn syrup, and so on and so on. And I mean, like we could talk about for the next hour just that. And I'm praying that RFK brings us at least a little bit up to speed, at least as far as bringing us. This is a situation where I do want to be like everybody else, like where red dye number 5 and yellow dye number 72 or whatever, or all the dyes are gone, because, oh my gosh, what are we using them for? Just to make our food look pretty?
Small side. Do you know about Bliss testing?
A little bit. Fill us in.
Right. So everything in America is Bliss tested now. Well, like foods that are marketed. So Bliss testing was first pioneered by Dr. Pepper, and it's where it's where you have two of the same product, only one of them slightly sweeter than the other, and then you blind taste test it and you see what do you prefer. And people will prefer the sweeter one, and then but at a certain point when it's too sweet, then it'll stop, like it peaks.
Okay,
when it's
right.
too sweet, so they find the point right at the top, where if it's sweeter than that, they don't. And so that's the bliss point. And they put as much sugar into everything as they can, so that they know a competitor can't come in and beat them by going to the bliss point. If a competitor is sweeter, it's going to be less. Like, well, they're like, we don't bliss test this, our competitors will. So the competition thing can start driven. So there's a lot of extra sugars in American food, like even things that don't need it, get it because blind taste tests show that people feel like we respond to that. Our bodies are supposed to like sugars. So
yeah.
Maha helping with some of the other byproducts and chemicals as well. But if we can cook for ourselves or different things like that, that's a big part of it. But trying to cut back on sugar, right, is actually more of a health issue than fats.
Oh yeah.
This is part of the thing, right? The food triangle being turned upside down, right? That all the grains and breads and stuff, we shouldn't be having 7 or 8 servings of those, right? That's the thing, So people, I think, are slowly getting around to that. But that's going to be a change.
Yeah, and I hope RFK does. And, it's funny because a lot of the stuff like those dyes, I've seen like pictures of like Fruit Loops in like, whatever, Denmark or something like
Yeah.
that. And it's the exact same cereal, but it's just like not as bright. And it's like, and that just that little bit of brightness makes people buy it. Like that's the marketing tactic is like people will just buy it because it's brighter. And I'm like, that's insane. That's, yeah, Tanya says grow your own food. That's the best case scenario if you have that kind of time, you know. Yeah, I used to be hung up on Red Bull. I that's definitely and I mean, once an addict, always an addict. I'm sure if I ever picked up one again, I'd be stuck again and have to break it again. But man, but yeah,
Right.
I'm
Yeah.
going on 3 weeks, 3 weeks
Yeah.
sober from
So
Red
yeah.
Bull.
So I want. So what this relates to is the government has an interest in our public health,
Yes.
right? They call it epidemiology. They have public health officials. Because they're paying for public health. So what that's done is as countries have taken on public health, they start getting more involved in what you're eating, the choices you're making. Well, the classic example of this was Soviet Russia, who part of their thing was everybody got free health care. And they found that it was really people were having tons of health problems from drinking alcohol. So to save them the money, because they were cash strapped, the Soviets banned alcohol. Right? It's prohibition. And health improved. People were still like with us. People were still consuming some vodka and things, but a lot less. It wasn't massively produced or anything like that.
Right.
And then they needed some money, and so they were like, "All right, well, you can have vodka, but we'll tax it really heavily, And
Right.
they made so much money off it. They liked that money. They then started marketing campaigns like drink more vodka. It's patriotic. And everybody started drinking vodka,
Oh
so
boy.
they get this money. And then all of a sudden, they have all these health problems, right?
Right.
And their health costs went up. And then they just go cold turkey. All right, no vodka. And so what we've seen here in America, a little more subtle than that, in our time has been a concerted attempt by the federal government to destroy the tobacco industry. They don't want people using tobacco, right?
Right.
And it still exists. They can't make it illegal, but it's a shell of what it was. The percentage of people that smoke cigarettes is just far less in America. Other countries, it's still very high. But that
Yeah.
was the thing, because their public health costs go way down when the number of people consuming cigarettes goes down.
Speaking of that, quick detour. What are your thoughts on? I mean, what are your thoughts on like excise taxes in general? Like, are you in the camp that they're like good for the government, good for us, good for? I mean, because obviously, like it disrupts free trade, but
Well, what are called sin taxes
right,
a lot of times in economics, it's behavior that's bad. So the point of the tax is not necessarily the money. I mean, you
uh,
take the money, but it's to discourage, by making it more expensive, that activity will happen less often, right? When a pack
right,
of cigarettes is 50 cents or something, right? People are like, why not? But now if a package of cigarettes is $10, right? They're gonna be like, really? What can I get with $10? And so they add all these taxes, and the whole point is so that the activity will happen less.
right.
And
Of
with
course,
sin taxes, the people will drink less. We know we can't ban it outright, but we'll make it. The very economic self-interest things is when prices go up. What they had found, it's sort of like gasoline. There is a slightly inelastic point when you're addicted to drugs, or when you're
hmm
addicted to cigarettes, that even if things get higher, you still consume them. So they had to do a lot of extra marketing to help, the social thing to, help people get off,
right,
right, rather than just relying on making it very expensive. And so,
right,
yeah, excise taxes, it's just one of those things the government does when they want to reduce a behavior that they can't make illegal, right? And it's like, why you tax coal power plants, or regulate them so heavily, so you don't
yeah,
have a million of them in town, right? You can
right,
have one or two, and you can still have a town. You have 15 of them because they're so profitable. and all of a sudden, no, it just ruins everything.
Yeah, I'm not sure how I feel about excise taxes in general. I'm kind of on the fence. Obviously I'm a free trade guy, but I mean, obviously I don't smoke and I don't drink, so a lot of these things are just like it just doesn't affect me. So I'm kind of I'm on that. But all right, so let's talk about some of the weaknesses of the American medical system, because in a perfect world, like America's actually much closer to a great healthcare system than people think. Like, it gets a lot of flack, it gets a lot of like criticism, but it's actually not that bad. It's just like there's just a few things that we need to fix. The biggest one is the gatekeepers, right? The biggest one is Big Pharma has a vice grip on the industry. It has so it starts with lobbying, which in a side note, I think we need to get money out of politics, right? Like, we really just need to take a stance where I think the simple answer is companies don't count as individuals when it comes to rights. That's the simplest.
So here's the problem. To
There's
advertise,
plenty of problems.
to advertise as a politician, to get your name out, because our populations have become so big,
Right.
you have to use mass media, right? And you have to pay for them.
Yep.
Right? You have to pay to be on where people are. And so, and it's one thing in, right, that's Florida, California, Texas are notoriously expensive to campaign in, because they have major markets that are all, you've got to buy advertising. In Los Angeles, expensive. San Diego, expensive. San Francisco, expensive. Like, you can't, like, in smaller states, you just buy and the whole state gets it. And so, because of the real cost of that, there has to be money, or people can't campaign and get their ideas out there.
Yeah. Don't get me wrong. I'm not talking about taking all money out. I'm not talking about removing, but I'm saying that individuals should count as individuals and companies should not. That's the simplest answer. So, and yes, it'll mean that people like Kamala Harris won't be able to afford a massive group of like celebrities that they pay millions of dollars each just to show up. Yes, it'll mean stuff like that gets cut out of politics. It'll mean that the way you advertise is, here's my ad, here's what I stand for, thank you for the 30-second clip, have a nice day. That'll be the campaign. And that's honestly, that's what I think. That's what politics should be. Politics shouldn't be like an enterprise where you're trying to like make all the. But anyway, this is kind of more of a side note,
Well, but the thing, right? Because politicians are, because of the current system, the politician that has more money doesn't necessarily win, but has an advantage in getting their name out there, especially when they're maybe not presidential. So, so when there's a pharma or a big company that's a quick source for a lot of cash, right? It's a one-stop shop rather than a 800-stop shop. That's really hard to turn down. Now, so the pharmaceuticals, right? Yeah, they have a lot of money, and they're using politicians to protect their profits, their windfall profits. My issue with gatekeepers is actually the AMA.
I was about to bring them up too. Yeah, tell us all about it.
So the AMA limits how many people can become doctors. Right? There was a big push in diversity and inclusion, and having getting more people of different racial and sexual and ethnicities medical training, which is fine. Just raise the number of people that can become doctors. But no, there's this hard cap, and there's so many more people that want to become doctors, go in the medical field. Like, anybody can become a nurse, but they won't let anybody become a doctor. And right, and that's the AMA. I think our healthcare costs can come way down, right? And you see this in other countries where they don't cap the number of people that can study, 100%. Can go to medical school, and can do this. And their excuse is, well, we don't want unscrupulous or poorly trained doctors or things like that. Well, you have tests, you have standardized tests like a bar exam or things like that. But I think, right, we'll get to this a little bit later, but there are going to be tools that are going to help to ensure that the quality of diagnosis and quality of care can be consistent and even better in places. But there are doctor shortages, especially in rural areas or
Yep.
places that are not glamorous, because doctors, when they make good money, they want to live in nice places. They don't want to live in dumpy places. Um, and there are lots of people who actually, because of other systemic problems, insurance problems in the medical field, get out and end up leaving medicine, and then that spot is just gone, right?
Yeah.
It's not right. So I feel like having, if the AMA could lose their grip on the number of students that can become doctors, that could be something that could help bring costs down and help improve America.
Yeah, absolutely. Absolutely. Yeah. If the more doctors, it's simple supply and demand, right? The more doctors, the cheaper they are. So Jesus said, healthcare should be free at the point of service. Our current system isn't healthcare, it's sick care. How else do you maximize profit? Right. So yeah, we're definitely talking about profit maximization. That's part of that is the AMA, part of that's Big Pharma. And part of it's a lot of other things, but I don't believe that healthcare should necessarily be free at the point of service. And the reason for that is it doesn't really matter where you pay for it. Right. People have this idea in their head where if it's like free as they're doing something, that it's free. And it feels that way. I'm sure it does, right? But it isn't. You're still paying for it. You're just paying for it one way or the other. One way you're paying for it in taxes, and the other way you're paying for it at the desk. Either way, you're going to pay for it. And moreover, there's a lot of simultaneously one of the strengths and weaknesses of American healthcare is that you get what you pay for, right? That's the strength and the weakness, right? So if I go to the doctor, I get what I pay for because I'm getting it and I'm paying for it, right? If I were to instead be part of this giant public system, I wouldn't be getting what I paid for. Somebody else would be getting what I pay for because I'm relatively healthy. And I don't smoke 10 packs of cigarettes a day, and I don't drink, and I don't do drugs, and I do, on and on, and I exercise, and I eat health, I do all the things. So to an extent, I don't get me wrong, because I love helping out other people, and I give to charities all the time, but I don't feel like I should be forced to give to others, especially in a situation where they're not going to use my money wisely. They're not going to be good stewards of it, right? If you've got somebody that's 450 pounds, they're not being a good steward of my health money. I'm sorry. And that's just how it is. If they want to use my money, get on a treadmill. Deal with, I know that sounds cruel. And here, one of the problems with our health system is just that, actually. What? My primary care physician, the one that I have now, is amazing. It's one of the best primary care physicians I've ever had because she's the only primary care physician that I've actually had that's actually encouraged me to be healthy, aside from just like, oh, what problems are you having? What symptoms do you show? Here's a drug, right? She's the only person that's been like, look, you should get off of Red Bull. You should get into the gym, exercise more, eat this, this, and this. They're really healthy for you. Like she's the first person that's actually treated my health comprehensively. All the other primary care physicians, it's like it's almost like they're mechanics. Oh, thank you so much, Tanya. All right. So which one are we talking about? You had a couple, something back. Tanya said, I agree with Jamie that they make healthy things even more expensive. You're talking about the food, I guess is what you're talking about. Yeah. They definitely make food extremely expensive, like
it's
good
expensive
food.
to be healthy.
Yeah.
Right.
Of course, unless you grow it. And that's
unhealthy is cheap.
Yeah, definitely that. Jesus says false. It does matter how you pay for it. If federally funded money is created, state down, it's tax collected money. I'm not sure what you. Okay, Tanya, I may have missed what you wrote. Which one? Let's see. I'm trying to find that statement. I know that. Yeah, I'm not seeing it. Christian, are you seeing it on your end?
No, all I saw was her either talking about growing her own food or her agreeing with Jamie.
Yeah, that's all I've got. Maybe.
Yeah, that it costs money to be healthy. Right? It costs money to be healthy.
Yeah, I don't know. I don't know if
Yeah.
they're putting anything in our food. That's a good question, but that's possible. They could be. I know that we've got all kinds of problems with our food, right? Like microplastics and stuff like that. Yeah. And all kinds of stuff. But of course, that's not necessarily part of the healthcare system itself. That's just a generic problem that we've got
Well,
to
yeah.
face. But yeah,
But dealing with those, right, then you'll have fewer people that need chronic long-term care, which are the real burden to the system.
but
Right? If we can improve our general health care, right, then the government will, and the health of the population overall, the government hopes to spend less money on health care.
yeah, I just want to be clear, utterly clear about this. There's no such thing as free healthcare. I know it's what people say. I know it's like a slogan, but there's just no such thing as free healthcare. There might be free healthcare to an individual, like someone who's in a vulnerable group, for example, like a veteran or somebody who's really elderly or someone who's really broke or something and applies for subsidies of some sort, Medicaid, Medicare. But there's no such thing as free healthcare, right? I'm going to end up paying for healthcare no matter what. And I pay for other people's healthcare no matter what. I already do, right? So
You
there's
can't
no such thing as free healthcare.
compel people to because some you have no right to compel another person's labor,
Yes.
and healthcare is another person's labor, and the government here, right, if they're going to do that, they're going to compensate them, they're going to
Yep.
pay for it, and that will lead to taxes and or debt.
Yeah, now I do agree with this. Tanya says FDA and pharma work together and people don't see it. Pharma and healthcare. There's more than just that too. There's all these back channels. These are the weaknesses of the American system, right? There's like a situation where hospitals will
Mm-hmm.
overcharge when they see that you have insurance because they know the insurance shoulders the burden. So they just like, well, let's just send a higher price point. When I pay cash, it's actually cheaper for me because I don't have insurance. I'm self-pay. They're like, oh, we can't cheat him and overcharge, right? And the same thing happens with the ER system and yeah.
So I have a thing about pharma, and I'm interested in your and everyone's solution. So one of the things is that pharma will do openly is, right. So they get 14 years when they create a new drug of this drug being patented and exclusive for them.
Yes.
But then once the drug comes off that patent, it can be generic, and the prices ostensibly come down. They don't get the windfall profits that they get during that patent period.
Right.
So what they want to do though is have drugs that are perfectly good and actually help serve things, but they want to push drugs that are still in their patent period, right? They want to come up with things. This is actually how OxyContin came in. They had a version, a pain pill that was morphine, slow release morphine, and but it was coming off patent. They made a lot of money off that. It wasn't as addictive. It was slow release morphine. So they came up with OxyContin, where it's essentially heroin, slow release heroin. Like they just made it super, super strong. And the push was, it was like doctors would be like, no, what you really need for your pain is this slow release morphine, but there's no money in that. So they would host steak dinners and other things like that and tell doctors, no, we need you to prescribe this drug that's in its 14-year patent period because we make so much more money on it. And so that's one of the things with ivermectin, right? When Joe Rogan was prescribed ivermectin, it's this amazing drug that won a Nobel Prize. It has so many health effects, not just dealing with parasites, but so many other ones. But it's out of its patent period, right? You can anybody can make it. It's not expensive to make. There aren't windfall profits to be made by selling it or by producing it. And so the pharmaceuticals got big, especially with the media and politicians, to mock it as an illegitimate medicine.
Yeah.
Right.
Yep.
Because what do they want? They want us to use the new stuff, right, that they can get the maximum profits on, rather than anything that could be a solution that's passed into the generic phase. That is the ultimate. That's why people stop losing lose trust in doctors when they're always pushing the newest thing because it's in its patent period. And when pharmaceutical countries will take drugs, stop making drugs that are older, that have been FDA approved, that work just well, so that they can make something slightly tweaked and get it in there, you know.
Yeah.
And that incentive drives me crazy. And I'm just interested in how you feel like we can stop it. What can be done?
Yeah, so that's a complicated, right? It's a complicated game, right? Anytime you go on like TV and you see a commercial and it's like ask your doctor if Ozempic is right for you or something like that's like, oh boy, here we go. Like, and then I always think it's hysterical how like, they'll tell you like 3 or 4 things the drug is supposed to do for you, and then they're like, but disclaimer, side effects might include, nausea, headaches, dizziness, shortness of breath, life-threatening illness, death. Like it's like, what is going on? Like some of the things I saw this drug the other day that had a side effect. It was like a nausea drug, and one of the side effects was nausea. I'm like, what in the world is going on?
Well, they have to. These are part of when they do drug testing. They take surveys from people. What are you feeling? Da, 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 da. They have to sort of disclose all of those, even if like placebo people. Anyway,
Right.
it's a liability thing that has to do with their testing of it.
So
it is pretty funny, but maybe advertising for these drugs now. Obviously, if it's something that hasn't been done before, I'm all for that innovation, right?
right.
But it's when they're doing the same thing that was done before, but they're just right. Let's just all right. We have this slow release morphine. We're just not making it. We just can't patent it anymore. What are we going to do? That should be fine. Let's make something stronger when it really doesn't need to be, just so we can make more money on it, right? And that created, the part of this opiate crisis, and
right.
they're being sued for it. But
now,
in other ways that people don't know about, that same thing is happening.
So, I'm trying to follow some of these comments. So yeah, what Jesus asked what Jamie meant about somebody else footing the bill. What that means is somebody else has to pay. I mean, somebody's got to pay for costs, right? You can't develop drugs for free. You can't provide care for free. That's labor, right? Any way you look at it, you're going to actually incur costs. Somebody's got to pay that. It doesn't matter if it's, the government through taxes or, the person at the price point or, et cetera, but somebody's got to pay for it, right? There's no such thing as like a free system. It's just, they all cost money. They all involve people.
Yeah, and they reward that with that patent period. So like, let's talk about hepatitis C, right? It was something that would just destroy your liver. Well, they finally developed a cure for it, right? It can be cured. And for the first 14 years, they get to charge really high rates for that to help recoup their research and development costs.
Right.
But then after 14 years, anybody can make it generically, and the costs come down. They can't charge these huge premiums for it. The issue though is right. So they have this thing. What if they go like, all right, hepatitis C cure plus? Well, they just add some little tweak on it, and now the time they get the 14 years again. Well, doctors that can still prescribe the generic one, which will cure hepatitis C, or they say they buy them steak dinners and take them on cruises and say, please prescribe this hepatitis plus drug that's still in our patent period so that we can make more money. And doctors will do it, right? I mean, when they have financial incentives to do it, they will do it.
So, hey, Zeus says, yeah, that's why you have the federal. Let me get to Valeria first. So Valeria says, this is the part that I absolutely hate, even with the healthcare providers and how they explain to you the secondary effects, making you right there think you will be dying next, right? And Jesus says that's why you have the federal government invest in R&D rather than war and incarceration. So I actually like this idea to an extent, right? Now, so it's dangerous because you give the government more
subsidizing billion-dollar companies,
right? And here's the biggest one of the challenges of a good healthcare system is that if you make the government the healthcare company, right? Like let's say you eliminate, whatever,
Blue Cross Blue Shield.
Blue Cross Blue Shield, but you eliminate a lot of different people, right? You eliminate, and then you've got the government, right? So now you've got more power in the hands of the government, which is dangerous by itself. Then the R&D field probably becomes stuff that they're going to use for war, like biological warfare, right? Because that's what the government does. That's the only thing they really do well, right? Not only that, when it comes to like a cost benefit analysis, and this is one of the problems that every other nation has that America doesn't have, right? And because one of the reasons that their prices are so cheap and ours is so expensive is because we really are footing the bill for everybody else's drug. We're footing the bill for everybody else's research and development. The problem is if we weren't doing it, nobody would do it.
Well, all right, that's a little bit extreme. Israel and Germany both have a large
Yes,
research
but
and
do you know that
development programs.
both Israel and Germany are having severe trouble with their healthcare right now, and both
Yeah,
of them are collapsing. So that's the problem, right? Because they're trying to compete with America. Part of it is the problem, but part of the other problem though is that they need more austerity to support that system because it's just so expensive. And if they did that, their costs would be commensurate with America's. They would be like ours, right? And that's part of the problem. Like it just doesn't get that much cheaper if you want to keep learning and developing and innovating. Now, I do have an idea
right.
for your prescription game, like the game that pharmaceutical companies
Yeah,
play. I think that they should classify all families of drugs, right? Like instead of in the same patent, right? Like so instead of, you know, Percocet and Oxy and everything like all on the, the Oxy line, like, and different variants of like certain amounts
yeah,
of Tylenol mixed
morphine.
in
Yeah,
and all
yeah,
that stuff. Like, I don't think that those should count as new drugs for a patent. I think it should just be this is the Oxy class, this is the Hydro class, end of story. This is the ibuprofen class, done. And I think that would solve part of the problem. It's definitely not a full solve, but that, and again, if we get lobbying out of the whole system, right? I mean, don't get me wrong, they're free to
well,
market, but
well, right. So Trump, right? We talked about how Obama wanted to expand. That was his drive. Trump has said in his first 100 days now he wants. Well, he tried to get rid of the AMA, Affordable Care Act. He failed. He wants to drive down costs. That's his emphasis, right?
yeah,
And he wants costs to come down, um, even at the expense of availability, right?
right.
So there are a lot of sob stories about people who might lose their free medical thing, if they can get on. He's willing to do that if it will bring down costs.
Right.
Um, the fear is that it will then lead to more free riders like your roommate scenario you described, right?
Tons.
Um, that's the worst case scenario for opponents. But any kind of change, right? He's just for now wants to emphasize a different leg of the three-pronged stool,
Right.
right? And let's see where it goes, right? If we try to drive down costs, what happens? Will people adjust? Will people get more health care? Especially, and he wants to remove subsidies. He doesn't want the government to be involved in R&D,
Right.
right? He says that we're inefficient at it. Other people should do that. We should save that money.
Yep.
So it's a different approach than what the left has had. It is, and maybe it is the relinquishing some of the federal government's power and influence, right?
Thank
By
God.
not giving hundreds of millions of dollars to Ivy League to do different research on health and development, right? Things for whatever reason, he's helping to drive down costs. And again, a lot of these things sound good when we can afford it, but we're running a deficit,
Yes.
right? And so healthcare is one of those things, especially at the federal level, that they have to take seriously. Just like we would budget, if our medical costs are making us go into debt, we're going to have to reassess, is it how much we're paying for it, try to find cheaper costs, or maybe try to find lower quality costs, or, right? And so those are all things that we would personally have to evaluate in our life, and the government has to do that as well. So
Yeah.
right now, we'll kind of see where it goes, but that's the path he's poured out in his first 100 days. Is he wants to go towards that. Now, the missing ingredient that people talk about is right how we can get quality and maybe lower costs. Is this magic bullet?
Well, I have an idea.
AI.
I
Anyway,
have,
we'll get to that. All right,
yeah,
so
well,
go
let's
on.
get to AI in a second. Well, I have an idea though. I have an idea for a system, and I want to get your thoughts on it. Right, this
Sure.
is an entire comprehensive healthcare system, and for
Okay,
some
yeah.
reason, I haven't
The
found
common man
anything.
healthcare system. You heard it
Right.
here first, people.
We're going to fix it all right now. And ironically, I haven't heard this system anywhere else. So it'll be the first, right? So, which probably means it's not going to work. But here's the idea, right? We have a public system base that people can opt out of, right? So the concept is you're automatically enrolled once you hit, job age, right? Once you're able to work, right? You're automatically enrolled, and you automatically have your own health savings account. That's basically, it's kind of an offshoot of Singapore, only not mandatory, right? So you got your own health savings account that you have to donate to unless you opt out of it. Now, in order to opt out, you have to qualify in certain ways, right? And one of them is like to prove that you have a certain amount of cushion above like a certain amount of money that you make that provides you with a cushion that will allow you to pay for your own, like prove that you can pay for yourself, basically, right? So like if you're making $8,000 a year and you're in poverty, right? You cannot opt out because you have to be
pass. It's called a stress test,
right.
right? So yeah,
So it'll be means oriented now, but you can't opt out of it. So if you make a certain amount, you can opt out, and then you can be a self-insured, or you can buy private insurance. And the goal is that public base will serve as like a baseline of competition for all the private companies, right? So then they're stuck having to compete with that baseline. Like it's not going to be high quality service, right? It's going to be low quality service. And
it's like McDonald's, right? All right.
Right.
McDonald's says something. If you make food that's worse than McDonald's, you go out of business, right? Because nobody will pay more for food that's worse than McDonald's. So the same way, if you have a baseline, this is the McDonald's of healthcare. Everything provided has to be better than that, or nobody will use it.
Okay. And in theory, the baseline system should be relatively like, high technologically advanced. Should be, hopefully AI will help, hopefully, and not kill us, hopefully. And, but that'll create a competition system. It'll also allow people the flexibility of choosing a better care provider if they like, if they've got money and they want to get, seen right away and have a nice private room with air conditioning and 4 doctors just spinning around in circles doing stuff for them. Great, then they can pay for it. But if not, you've got this baseline so everybody can be
share a room.
Yeah, that's right, and that's all right though. Right? Like you're gonna get seen, you're gonna get service, you're gonna get well in theory, right? And then couple that with a pharmaceutical program that's similar, right? There'll be like a brand generic that automatically the government gets access to, kind of like a regulatory thing, and that's going to be hard to manage. But then part of the funding should also go to R&D, I think. So part of our taxes should go to R&D.
Okay.
That's my comprehensive plan. What do you think?
Well, I think that's interesting. It's so one of my pet peeves, and not to change the subject a little. This is I like that idea of sort of baseline. When I was a kid, we had a public at the end of my street. We had a public health center. It wasn't a hospital, but you go in there and get shots or other public health services. It was not a glamorous building, right?
Yeah.
You want to think about like, ugly building in California. This was the definition of it. Nice. I go to the hospitals here in Raleigh, North Carolina, Duke, Chapel Hill area. Now, this is also a medical hub of the world, but all these hospitals are like palaces.
Yes.
They're all architecturally interesting. They are gorgeous. I mean, the oak or the walnut veneers, when you go inside Duke Hospital, you're like, oh my God. Like it is the most luxury. You walk around Wake Med, and it is like these windows. It's like some fancy architect. I'm like, dude, does our healthcare have to be done in architecturally significant buildings? And then I even heard like that campus, the Wake Tech campus, isn't good enough. They want to like raise that thing and build a new one. Like it's not nice enough because the one in Cary is nicer. Like all these hospitals are just gorgeous, and I'm like, gosh, there's so much money in this. Why can't we go back to slightly dull or boring hospital facilities? My doctor that I went to, my family care physician, he worked out of an extremely unglamorous office, and he was able to
Right.
provide, because what it was his head, and he was unpretentious about that.
There you
But
go.
boy, there's a Duke
Right.
healthcare thing just right down the street from me that does orthopedic and stuff like that. Man, those buildings are gorgeous.
And they're
Gorgeous.
expensive. They charge for it too. They definitely
Right.
you can definitely see the architectural costs in the bill. Like you go to you stay at Hotel Duke. Oh my gosh. I spent there
Yeah.
I had an infection and I spent like a week there and it's like thousands of dollars, just thousands and
Yeah.
thousands of dollars, a night.
I,
It's like
I,
insane.
I went in for some x-rays for a hiatal hernia diagnosis, and I was like the stonework and the woodwork. I'm like, what the freak am I going into? Like, anyway, so doctors need to be well paid so that there's incentives there, because it's the sacrifices they're making. But there
Absolutely.
is, I think, it's a little bit sometimes too much money, at least in it seems obviously in rural healthcare there's not enough, but in places where people want to be, right, these hospitals, and they compete with each other and they're just palaces. So I would like to see if there could be some sort of pushback on that, because they
Yeah.
want people to come to these because it's a nicer,
Of course.
looking building.
Of course, of course. Right, right, right. That's the game, right? It's like that's marketing in and of itself. They're just trying to make it, so that you go to Duke instead of Wake Med or instead of UNC or
Yes,
something. It's like,
yeah,
but
correct.
yeah, it does. At least it looks nice, right? Like Jamie says. All right, so those are that's a lot of the weaknesses of America. That's my answer, right? That's my plan.
Yeah,
I think it should be subsidized by a charity system that we really need to get back to in America. We need to have a pool. See, because this is what drives me nuts. What drives me nuts about all of these fantastic communistic socialistic programs, right? Like all these socialist programs, all these communist programs where everybody wants to pool all their resources and then have free something, right? You guys can all do that. You can already do it. Nothing is stopping you. No one is stopping you from getting a group of people together and saying, all right, we're all going to put money into this account. And then anytime somebody needs medical care, we take it out of this account. Nobody's stopping anyone from doing that. No one's even stopping businesses from managing things like that. No one's stopping communities from doing this. No one's stopping anyone from doing that.
well, it's not insurance, and I think that's part of the thing is people want sometimes at the end of the day,
But it
no,
could
like
be.
insurance
It
has
could
an
be.
obligation to pay that bill, or it's insurance's responsibility. And yes, charities should pick up some of the slack, but we're a very litigious society. We want to know where the buck stops, who we can hold accountable,
Sure.
and this is the type of thing when you'll have exploiters who will try to drain every last cent out of that charitable
Of course.
globe, right?
And people do that with insurance companies too, though. There's definitely insurance fraud in the world, right? It's not like that doesn't exist. And so you'd have to have the same structure. But I'm just saying, it's not like people can't get together and have this magical shared resource pool. They can. They can do it now. Anybody right now can do it. They just don't. That's the crazy part, right? This is what I don't get is I could talk to 20 people tomorrow who are like, oh, we need single payer. We need single payer. We need single payer. For those of you guys who aren't as familiar, single payer is a public system where the government, you pay taxes
pays
and
everything.
all the payer, the government is the single payer, right? But you could do that right now with a community or with a city or with a state. You could do it at any level up to the federal government, right? And the federal government is the worst place to do it. It is the worst place to do it. It is the
100%.
least likely to be accountable. It is the most likely to be fraudulently operated. It's going to have the maximum amount of middle management waste. It's going to it's unconstitutional. I could go on and on and on why that's the wrong place to do it. And if we go there, it is what it is. But every other stage of the way, there's an option for what they're looking for, and they just don't do it. And so I'm like, if you won't do it yourself, why would you expect everyone to do it? I just don't get it. Like, if you're the kind of person who won't get a group of people together to live in a commune and do everything together and share all of the money, if you won't do that, why is it that you want the government of America to
Yeah.
make everyone do it?
Compel it. Yeah.
So
Yeah.
Tanya
It
says,
doesn't make sense. But yeah, you're talking about, yeah. So obviously people like us who are relatively healthy, and don't have chronic um, drug, alcohol, tobacco issues, stimulant issues. Um, our healthcare costs are much less than somebody, who have chronic illnesses, right? And so,
yeah,
people who suffer from chronic illnesses are going to pay more into the system, right? We sort of have to accept that that there are going to be people who need more. If it's you got to look at it. Is it preventable? Is it something that they were born with, or
yes,
something an accident that happened, or is it something that if their behavior changed, they would need health care less? Because healthcare should be right. You're broken, right? Your car is broken. There's regular maintenance you can do to keep your engine from breaking down, like changing the oil, right, and things like that, rather than just like drive an engine until it dies,
right,
and then go to the mechanic, have them, all right, here's a new engine. Maybe every so often, every 3 to 5,000 miles, you go in, have somebody look at it, say, oh, you need this filter, you need this bushing, you need this gasket, you need some oil. All
right.
right, go on. Right. And that's type of thing like healthcare has come where we have to allow people the freedom to individually manage their own healthcare, but some people are bad at it, right? Some people
Jamie,
are bad.
so Jamie says if we can fly and land 20-story rocket ships and build AI robots, we should be able to figure out. Right, it shouldn't be that difficult, right? But it
We
is.
just want to not die. I mean, this is
No,
America. Come on.
it's that simple, right? And of course, right, if we solve this problem, then we won't have crazies like Luigi Mangione going out and just killing people for no reason. And yeah, I mean, obviously, this seems like a easy enough problem to solve. It seems like it, but there's a lot of obviously there's a lot of pushback, and everybody, it's hard to
Well,
get everybody to agree.
there's probably a shot invented in 1971 that cures everything, but
Right.
nobody can make any money off it, so nobody wants to make it.
That's right.
So,
How do you put a meter on that, right? Like, do you ever hear that story? Was it the Tesla story where he basically JP Morgan gave him like a front to develop like an energy system, and it was going to be a thing where you supposed to it was supposed to be metered, right? It's supposed to be
yeah,
they pay me for energy, and I'm going to be an energy guy. And
yeah,
Tesla's like, oh well, I could develop something that'll just send free energy around the world everywhere. And JP Morgan was like, well, I can't sell that. And so like he took his money back and then blacklisted him. And so that's
yeah.
why Nikola Tesla didn't get like a lot of his stuff didn't go anywhere. And it was like all ended up in these like crates, like all his files and stuff, all of his research ended up in these crates that guess who got them? Trump's father
Yeah.
and the government. The government got most of it, and Trump's father got
Yeah.
like a couple of them. But yeah, it's kind of wild. It's like all of these conspiracies come together. I'm sure there's like all these cures that are out there that people have access to, but they just can't they can't let it out of the bag because the moment they
That's
do,
dark. That's really dark. But that ultimately, if the government is involved, the push right to actually cure people rather than keep them sick to make the most money out of it, you think would be the drive.
so
And
yeah,
that's yeah.
it's complicated. So it's really weird because so capitalism is like the only thing that gets us to a certain point. It's the only system that pulls us up to like here, right? But then after you're here, it also prevents you from going here because it's like there's resistance to go higher because of that same situation, right? That's why you don't want to make a car too good. You don't want to make a car so good that nobody has to buy another one. You don't want to make medicine too good. You don't want to make people so healthy that they don't come back. You don't want to make
Never
these
try
things
your
that
best. Yeah. Or people will
so it's
always expect
complicated, right? Like what you need
that.
is like some weird combination of the two. That's what I hope my system would do is
Yeah.
present that combination where there's still innovation because they have to make it in order to entice people off of the public system. But
Yeah.
but if they're not doing that, then there's still coverage for everyone. You don't lose that. You don't people drop. But I'm sure it's the system's just as
And the
gameable as
public
anything else.
system was only generic drugs. Interesting. Yeah, if you want the cutting edge stuff, you got to get off the public system.
Right.
I think that could be interesting, especially right if AI can give diagnostic quality
Yes.
more right, and that AI won't be manipulated by the pharmaceuticals offering them steaks and
I just
Caribbean vacations, right?
I just
That
hope
they'll
it's
say,
not
no, this is the
manipulated by
best.
AI.
This is the best drug to solve your problem, even though it was made in 1963 and has no patents on it.
Now, I will say AI is, I mean, in theory, some of the new stuff that's coming out for AI is like they'll have robotics doctors essentially that will be able to detect diseases on you just by like the intake of the air around you. No, I'm serious. Like they've already got some of this. Like they have
Your
like
phrenology. It's all about phrenology, right?
yeah.
Yeah.
I mean, like they can literally smell it on your breath, right?
Yeah.
Like they'll be like, okay, you've got XYZ, you've got this cancer or that cancer, you've got these pre-markers, and they like make far less mistakes than like a normal doctor does. So they're already more accurate. You know what I mean? Like that's going to bring costs down when you can just build a new doctor you can build 1,000 new doctors a day. In theory, of course, they're still going to control it so that it's like they optimize that price. So they hit that bliss point, right?
We'll see. We'll see how the AMA restricts that because there's still
Right.
It's all,
Oh.
I'm interested, right? If is the other politicians, is there a political party that's willing to stand up to the AMA? We'll see.
It's hard. Yeah, we'll see. But anyway, guys, you were amazing. Thank you so much for watching. As always, please like, share, and subscribe, and tell everybody about us. We need help getting our name out there. Obviously, we're still only getting like a couple hundred views a session, but I'm not. Just let me know, guys, what you guys want to see too. Because if you have requests, if you have, and we love you too, Tanya. Thank you so much. If
The
you guys
best
have
podcast on the internet, right here.
Right, aren't we? And I mean, if you guys have something you want to hear about or a topic you want us to do, just let us know, and we'll get on it. And I've noticed we always do better when we talk about current events, so that may be a thing. Like it may be that we do private recordings for like individual topics, and then always current events for the live. I don't know, but anyway, let me know what you guys think. Put some comments below, and we'll catch you next time. Comment mansplaining.
Common solutions.